Good afternoon. Want to thank you all for joining us here today. I have the Secretary of Health, Kim Malsom-Risden, with me, and also the Secretary of Tribal Affairs, David Flute. I appreciate them being here as well. I want to provide a quick update on some economic development loans that we have been working on. It's called the Small Business Relief Fund, and a couple of high-level details for your information is that we have spent $10.5 million that have gone out the door to 200 businesses across the state of South Dakota. These businesses literally span the entire state, from every corner to every region. Custer's, Spearfish, Rapid City, Pierre, Huron, Mobridge, Aberdeen, Watertown, Mitchell, Brookings, Sioux Falls, Yankton, Vermilion, and North Sioux City. We're helping restaurants, retail shops, hotels, salons, trade shops, construction and manufacturing, and many more different kinds of businesses. From the time that this legislation was signed into law until the time we approved the final loan allocating the dollars of relief, it took just over 3 weeks. And so I specifically want to thank our team over at Economic Development. They were amazing in how they recognized the need that these family businesses had to pay bills, to be able to keep their operation going, to provide for their employees and their families. And they worked overtime many times through the night to make sure that they got those dollars out the door as soon as possible. Also recognizing that sometimes the loans and the help that was available at the federal level would take much longer, they knew it was important for the state to respond immediately. I wanted to give you a quick update on some supplies that will be going out from the state of South Dakota to our healthcare providers. As healthcare providers resume services throughout the state to take care of folks, securing the appropriate personal protective equipment from vendors will be critical to make sure that they can continue their operations. So I'd like to invite the Secretary of Health up to talk a little bit about how the state is going to get PPE out to these healthcare providers.
Thank you, Governor. As we've talked in the past, the supply chain for certain aspects of personal protective equipment has been challenging for our healthcare providers to be able to order that equipment on their own. We've heard that from certain providers in particular. We at the state level have also had some challenges, but just recently have seen some easing of the supply chain, and so very pleased that we're in a position now to be able to help those medical providers across the state with their PPE needs. This will be limited as our supplies are still limited, and we have to make sure that we'll have enough for any COVID response specifically, but we'll be working with the professional licensing boards that are part of the Department of Health. We have 13 different boards to work with their licensed members on distributing a limited supply of N95 masks, surgical masks, face shields, and other equipment that will help people provide health care. I just want to do a shout out to all the healthcare workers in the state. It's been obviously a very challenging time on so many fronts, and one of the things that we're seeing is people foregoing regular health care, and that can be a real risk to people's health as well. So we want to make sure people are able to get the health care that they need in a safe way, and making sure that people have PPE is part of that. So I'm really glad to have this announcement today and see a positive change in that area.
And again, for those that have been reaching out wanting PPE, the State Department of Health will be working with the licensing boards to make sure that that's allocated out in a fair manner. We've also had a lot of questions about the checkpoint issues with tribes in the state of South Dakota, so I've asked Secretary Flute if he would join us today and address some of the timeline and communication and relationships that he's had with our tribes and what is going on in regards to the checkpoints. So with that, I'll turn it over to Secretary Flute.
I want to say thank you, Governor. I want to say good afternoon to all of you here today. I'd like to speak my language a little bit. Oya mitaku api, oya tokahea I tokab na waji dead. Iuha chante washte na pechius api. Odean petug de I tokab na waji. Wotwachi washte yuhat na ha. Da kodwo pe yuhama wanikte. Uka am petug de Taku I wohenda kapikta. He tokata kia oyate iwa stepte te tan yachupikte. For those of you that don't know me, I'd like to share a brief introduction of myself to the state of South Dakota. My name is David Flute. I am a member of the Siston-Wahpeton Sioux tribe, former tribal council member of my tribe, and a former tribal chairman. I served on a number of regional boards for our tribe, and I did serve on the HHS Secretary's Tribal Advisory Board for a period there. I was a member of the South Dakota Army National Guard. I did serve a tour with the 235th Military Police Company in Afghanistan, and that brought me a lot of experience, gave me some time to reflect on service to my country and to get into tribal public service, and that's why I got into tribal government. I want to share a little bit about the work we've been doing with our tribes in COVID-19. The one most important is communication, and very thankful for Secretary Malcolm Rydson and her team in working with the Department of Tribal Relations and having us to facilitate these calls, the tribal weekly calls, where she's able to provide information to the tribes and offering the tribes an opportunity to ask questions of the Department of Health. We've been in contact with Region 8, with FEMA, Region 8. We were coordinating some important communications with them. An example is the tribes. A few of our tribes were slaughtering their buffalo to increase their food surplus. They were slaughtering their livestock, wanting to prepare for any shortages in food. And the question had never been asked of if this is a reimbursable expense, and my agency and my team had reached out and had asked that question to Region 8, and they were able to get us an answer, and it was a good answer. The tribes are able to use that as a reimbursable cost. So those are just a couple of things among disseminating a lot of information to our tribes that come from Indian Health Service, BIA Regional. We've been sharing a lot of information on the COVID, any updates. But, you know, among other things this past year and last 18 months, we've worked on other issues where the key to accomplishing those issues was communication. And I felt it was necessary, and I'm very thankful for the governor inviting me here today to share information that I think is important and it's fair to share with the state of South Dakota as South Dakota citizens, not just as tribal members that are listening, but all of South Dakota, that on behalf of the governor, when these checkpoints were being established by our tribes, a few of our tribes, we were alerted to it. And we shared that with the governor, and we shared it with senior leadership, and we had it on our radar, and we were monitoring how those checkpoints were being operated. Unfortunately, Chairman Frazier and I had a couple of calls, and the chairman's a good friend of mine. He was sharing with me that the checkpoints were running smooth and that there were no complaints. And I would share with the chairman that we were hearing different, and that there were some concerns and some complaints from both his tribal members and from non-tribal members. And so we felt it was necessary to share that information. And on behalf of the governor, I was asked to reach out to Chairman Frazier and other tribes in the area if they would join us for a conference call so that we could hear their concerns and that they could also hear our concerns, that from the constituent calls we were getting and just general concerns, we felt it was best to communicate. On April 18th, I had shared with the chairman we were going to try to coordinate a call with him. And on April 21st, and I say this respectfully, being a former chairman myself, I respect Chairman Frazier, but respectfully, the chairman declined. The chairman flat out said he would not join the state of South Dakota for a conference call to discuss this tribal checkpoint issue. And so I felt it was necessary to share that information with the state of South Dakota, as I am disheartened not just as an enrolled member or as a former tribal chairman that understands communication is key when you're talking to other governments, but also as a South Dakota citizen. I'm disheartened with the attacks on Governor Noem, and I felt it was necessary that the time is right to share that information, considering the current things that are being said, just to share that the state of South Dakota did reach out to the chairman and asked for him to join us on a conference call so that we could work this out at the lowest level possible. I'll say thank you.
Thank you, Secretary Flute. And we have been, as far as the state of South Dakota, communicating with our tribal leadership. I personally have communicated with Chairman Frazier through phone calls and texts as well. And we're hoping that we can come to an agreement. What we're looking for is clarification. And respecting tribal sovereignty, which is something I always have done in my words and in my actions, but also making sure that we have the ability to protect people. And this is a sticky situation because we have federal authorities on U.S. and state highways. I recognize that it would take federal action for the law to be upheld, but yet South Dakota is leading our COVID-19 response and making sure that we are doing that responsibly and able to get adequate supplies, needs, and emergency services to people should they need that. So I have sent further communication with Chairman Frazier today and look forward to his response on a plan that we could agree to make sure that we're both happy with the situation going forward. I want to end on a couple of other notes that have to do with this week. This week is National Hospital Week. And so for all of you across the state of South Dakota, if you have the opportunity to thank not just those on the front lines, the doctors and the nurses, emergency room personnel, people that have been working overtime to take care of us, we really do appreciate them, but also the leadership that's making decisions that have linked arms with us to make sure we're making the best decisions for South Dakota. I have so appreciated even the administrators and the leadership of our hospital systems, because I don't think in any other state in this country have we had all the hospital systems in a state stand side by side with the Department of Health and commit so much time and resources to helping us make the best decisions possible for the people of South Dakota. They've been candid, they've been honest, they've helped us come up with projections to make sure we're making wise decisions, and I've just so appreciated that and their commitment to making sure that the decisions were not just keeping their own best interest in mind, but the people of South Dakota in mind. And so their ability to take care of the people that work for them, that are out on the front lines, I appreciate those doctors and nurses and folks working in our healthcare facilities, because they've been amazing, and we couldn't have possibly even thought about accomplishing a little bit of what we've done without them. It also is Law Enforcement Week. And we've asked a lot of our first responders the last several months, and again, I want them to know how much we appreciate them being out there, filling in extra duties, doing things that they maybe haven't in the past on a regular basis because of the situation that we're in. But if you have a law enforcement officer in your family or in your community, reach out to them. Maybe put a mention on their Facebook page, or call them, or send an email, or maybe even write them a note. I know they would certainly appreciate it. And finally, our 114th Fighter Wing in Sioux Falls is planning to participate in the Air Force Salutes Flyover Initiative. This 114th Wing is going to have their own flyover on May 16th. It's going to fly over our East River area hospitals, and this is their chance to recognize our healthcare workers and first responders that have been on the front lines of the COVID-19 effort. So details of where they will be flying and what time will be on covid.sd.gov. For those of you that haven't been able to see a flyover yet, it's incredibly impressive, and I would encourage you on May 16th to set aside some time to go outside and to see the flyovers over these hospitals, East River, because it's going to be impressive, and we're so grateful for their service to our nation. With that, we'll open it up to any questions that you may have.
Governor, this is Stephen Gross from the AP.
Sure, go ahead, Stephen.
So can you tell me a little bit about what the plan is moving forward with this checkpoint issue? Will you file a lawsuit against the tribes that have checkpoints up?
I've sent communication to Chairman Frazier today, and I'm hopeful that he will respond.
So right now, there's no lawsuit in the works?
There is not a lawsuit at works today, no.
Gordon Richard, Alcester Union Hudsonite.
Sure, go ahead, Gordon.
Yeah, Governor, on the there were 17 legislators that had written you wanting to help intervene in the whole reservation situation. Are you going to be soliciting their help? And then is Secretary Flute, is he your tribal liaison on your cabinet?
Yes, Secretary Flute is my Tribal Relations Secretary. He's a cabinet official and one of my closest advisors. We have visited with some of those folks that have signed on to that letter and appreciated those conversations. I don't know if Secretary Flute has anything he'd like to add, but he has given me incredible wisdom and insight into these relationships those legislators, we talk on a daily basis. They talk to my staff on a daily basis. I know that Secretary Flute has had conversations as well with them in the past. And so I'm not certain what else we could potentially do to hear more from them and their thoughts and their expertise.
Governor Noem. Hi, this is Alexis Davila with Coda Territory News.
Okay.
I understand that you've talked a lot to Chairman Frazier. Has that same effort, a lot of effort of communicating to Julian Bear Runner of the Oglala Sioux Tribe?
I have not personally spoken or communicated with Julian Bear Runner. I know my team has spoken with him, and I'll let Secretary Flute speak a little bit to communications that he may have experienced with the Oglala.
Yeah, Secretary Flute, Tribal Relations. Thank you for the question. We have, again, communication is key. Both parties have to be at the table when you communicate, and we have extended our hand on behalf of the governor in the state of South Dakota to President Bear Runner a number of times. We did have one conversation with him. It was in specifically to a tribal member of his that was being released from the Department of Corrections, and she wanted to make sure she would have free passage onto the reservation. Unfortunately, that didn't turn out the way she had anticipated. But we have reached out to the Oglala Sioux Tribe, and we share information with them all the time. Thank you.
Hi, this is Alex Porto with the Black Hills Pioneer.
Sure, Alex, go ahead.
Hi. So your office is arguing that these checkpoints are illegal and that they need to be removed. If the checkpoints are illegal today, they were illegal the day they went up. Why has it taken so long for legal action to be mentioned?
Because we've been working with the tribes to get the issues resolved.
Thank you.
Megan Brett, News Center 1.
Sure, go ahead.
You just mentioned that, or Secretary Flute just mentioned that they'd had one conversation with the Oglala Sioux Tribe. What conversations have been had with the Oglala Sioux Tribe in relation to these checkpoints during that time then?
They are included on all the weekly calls that happen with the Department of Health on COVID-19 issues. Also, Secretary Flute reaches out to all the chairmen on a regular basis and shares all the same information with President Bear Runner that he does with every other tribal chairman. All opportunities are given to every single chairman and president of our tribes equally.
Governor Noem with Coda Territory News again.
Yes.
I understand that you also had kind of pushed for municipality and local type of governments to help make decisions with coronavirus because they might be best at understanding how to protect their people. Why is that seeming not to play out when it comes to these tribal checkpoints and not being in the hands of just the tribal law?
Well, that's a completely inaccurate statement. The tribes do have authority on BIA roads. If they chose to set up checkpoints on BIA roads, I've told them that would be acceptable. Instead, they chose to set them up on state and federal highways, and that's where the issue happens. That is where we need some clarification on how those can be conducted and if they can be there at all.
Thank you.
Governor, this is Stephen Gross from AP.
Sure, Stephen.
I wonder if you could tell us a little bit about kind of your approach and your thinking with issuing the letter to the two tribes on Friday, giving them 48 hours to take down the checkpoints and threatening legal action if they didn't. Why was that necessary at that point? And is this a change in the approach that you have taken previously?
No, we had previous conversations for weeks prior to that. On Friday, we needed a resolution, and that is why we gave them a time frame in which we would anticipate a response. We have a question here in the room. Bob, did you have a question?
Yeah, Governor, Bob Mercer with Keller Land News. Have you given any thought or have you discussed at all with your State Department of Transportation about putting up any signs that warn travelers or advise travelers that there are checkpoints ahead, whether it's down at Oglala or Pine Ridge or at Cheyenne River?
No, we haven't considered putting up any kind of warning system or using the DOT to let travelers know that there would be checkpoints ahead. Obviously, we have every extra resource focused on COVID-19 in the state of South Dakota, and DOT has been incredibly helpful to us as well in responding to extra duties and responsibilities. The capacity to do that with as many checkpoints as are out there would be something that I would wonder if we even had the ability to do.
Governor Patrick
Governor
Callahan,
Megan
South
Ranian
Dakota
with
Broadcasters.
Megan, we're going to go to Patrick in the room, and then I'll come to you.
Every good deal has a compromise. What's the compromise with the tribes as you see it?
Well, it's pretty much what I've been visiting with them about for weeks now, is that if they wanted to have these checkpoints on BIA roads and believed that they felt that was appropriate, that is something that they have the opportunity to do. We have been consistent in our message that this becomes an issue when those checkpoints are set up on state highways and on U.S. highways. Okay, Megan, go ahead.
Thank you, Governor. Secretary Flute mentioned that Chairman Frazier had some calls and said that the checkpoints on the Cheyenne River were running smooth and there were zero complaints, but the state had heard otherwise. What has been heard from the Oglala Sioux tribe in relation to that, and have there been any concerns from both tribal or non-tribal members?
You mean as far as people running into issues with checkpoints down on Oglala?
Yes.
Do you have anything to share there?
Yeah, hi, Secretary Flute, Tribal Relations. Thank you for the question. You know, when we started taking phone calls, some of the first logged phone calls were coming respectfully from their tribal members, and I'm talking of Oglala Sioux. There was an instance where a tribal farmer was ranching, getting ready for calving season, and had some nephews that were living in Nebraska. They weren't being able to come across on that state highway. I'm not sure what highway that is, but that was the concern he had. And so that is one instance whereupon we had, a circumstance with that issue.
Has that been a follow-up? Has that been it?
No, that would not be the only phone call that we've received as a state of South Dakota. We've received many phone calls, and I believe if you would ask our congressional delegation, they would indicate that they're getting a lot of phone calls too. And as this is being a federal issue, those offices might be good to reach out to.
Thank you.
Governor JP from KORN News Radio.
Sure, go ahead, JP.
Thank you. I see that the Pine Ridge Reservation is on a 72-hour lockdown due to the positive testing of 2 people on the reservation. Do you have any concerns about that?
Well, they certainly have authorities when it comes to their tribal government and decisions that they make for their people. I'll have Kim speak specifically to those 2 positive cases and share what she knows.
So we did see media reports here this afternoon indicating 2 additional cases in Oglala, Lakota County. Those did not come in and were not reported by 5 p.m. yesterday, so they were not part of the count today. Based on those media reports, we would expect to see those tomorrow. And I'll just refresh people's memories. The way that reporting happens is once a lab processes a test for COVID-19, they notify the person's provider of the test result, and then it's that provider that notifies the patient. And so after all of that happens, the Department of Health gets notified. As in any other case, we would commence an investigation at the state level to identify any close contacts of those positive cases and help people have the right direction so that they can stay safe and keep others safe.
Thank you.
And one thing that I think is a good reminder for everybody in the state of South Dakota, that we provide opportunities to individuals who have tested positive from the virus, an opportunity that if they can't self-isolate at home in their residence, that we will help them find a spot that they could isolate and protect themselves and their family and keep them healthy. Bob?
Governor Mike Tanner from KWAT.
Mike, I'm going to take your question and then I'm going to go to Bob here in the room.
Thank you, Governor. It was announced here recently that the North Dakota State Fair is canceled for this year. Do you envision a scenario where the South Dakota State Fair could still be held? And when those decisions are made, will you or a member of your team be part of those conversations?
Yes, Lieutenant Governor Larry Roden is working on State Fair planning today. We do hope to hold the South Dakota State Fair and plan to do so. We're thinking out of the box about ways that we can continue on with the fair and still keep people safe and public health a priority. Bob?
Thank you.
Governor, just to change focus a little bit on the PPE equipment you're going to be giving away. Is the state paying for that, or will there be any charge?
So the question was around the PPE for healthcare workers. That is equipment that's been provided to us through FEMA, and so there will not be any charge to licensees that request that PPE from their licensing board. I do want to reiterate, though, that we're not sure if this is going to be something that we would be able to maintain. It could very well be a one-time opportunity, but nevertheless, we're happy to get that out there into healthcare providers' hands. It really depends. N95. So our state stockpile, of course, is larger than what we'll be seeing, being put out for this particular need. But we will be making sure that folks have access to N95 masks. Those have come down in price recently if you're trying to buy those on the open market, and they're not quite where they were before COVID started, but still it's a valuable resource to those healthcare providers. We'll also have surgical masks available and face shields, which some healthcare professionals would find useful. The value on those will really obviously depend on the volume, and we'll be working with our licensing board to determine kind of what the needs are out there. Yep. So providers, licensing boards will be reaching out to the folks that they license, and be providing more information about the process to request PPE, as well as gauging kind of what kind of things would be most useful to their folks.
Further questions?
Yeah, Governor.
Yeah.
Okay.
Governor, if the tribes don't remove the checkpoints on federal and state highways, will you continue with the lawsuit?
I'm not certain about that question, but I did send the chairman a letter today, and I'm hoping he responds. I think there was another question.
I have a quick question about the PPE equipment.
Sure.
Is any of that going directly to some of the reservations?
So the PPE is geared towards licensed healthcare professionals statewide, so it won't be limited in any way, and it would be available to folks no matter where they're practicing.
And I also have one more question. When it came to the Oyate Health Center here in Rapid City, there were some concerns about the whole case number reporting and finding out if South Dakota Department of Health is kind of saying this and telling us in enough time and giving us notice and whatnot. I mean, can you respond to any of that?
I'm not sure what you're referring to. I can tell you that the process for lab result reporting is the same no matter where those labs are. And so if there's a lab out in Rapid City that's doing COVID tests, they would be required to report positive and negative cases to us, just like any other lab would. We do have, as I've mentioned, we have a 5 p.m. cutoff so that we can start to notify individuals and start to investigate those cases in terms of what we report the next day. But the reporting requirements are the same no matter what lab is doing the testing.
Thank you.
Lee Strubinger, SCPB.
Sure, go ahead, Lee.
Thank you, Governor. I was just wondering if you could comment real quick about the Eighth Circuit Court decision from 1990 saying that the state of South Dakota doesn't have jurisdiction over highways within tribal land.
There are several different court decisions at play here in this situation that we have, so to comment on one would not be appropriate.
Okay, thank you.
Thanks, Lee. Any further questions?
Governor Megan Rath here again with News Center 1.
Sure, go ahead, Megan.
Can you talk about what you sent in the letter today to Chairman Frazier and if a similar letter was sent to President Bear Runner?
You know, we will let Chairman Frazier, and we are anticipating a letter to, I'm not sure if he's received it yet, President Bear Runner as well. But if he has, then we will certainly be sharing that with you. But I wanted to give them the courtesy of letting them have it first and digest it and get a response. So we'll share that with you. Just wanted to make sure that they had adequate time before we and gave them an opportunity to respond to us before we released it to the press. Just out of courtesy and respect. Okay, thanks so much.